The city of Quincy is approximately 95,000 residents. It sounds like a very large city, but it gets very small when people are overdosing. Back in 2008, 9, and 10, we were experiencing a huge spike in overdose deaths as a result of opioids, specifically at that time heroin. The biggest tipping point was we lost 2 children of officers on this job, and they realized how small the city got, how it affects everyone. We entered into a partnership with the Department of Public Health to go out and do the post-overdose visits.
Once a week, we'll run the reports for all the overdoses for the city. And on Thursday night, we'll do our visits. 2 officers from the community police unit, along with Man at Health. It's a cold visit. We're in plain clothes, so it's low-key.
We've been doing the home visits for 3.5 years now. Been able to enter the home and engage with the individuals about 97 to 98% of the time, which is incredible because they were able to say to their friends, hey, they really got me some help. Or no, they didn't break down my door and push me into the house and say, you know, you're going to do X, Y, and Z or get arrested. They just provided things. And they actually trained me in Narcan and left some for me. And then on those situations, there were a couple of instances where the Narcan that was left after training by the team reversed someone that overdosed in the home. So that word spread. We're reversing approximately 200 individuals a year. And we were inundated with overdoses. There's absolutely no doubt about it. What we've done in the past, literally over decades, hasn't truly worked. So we just had to change our mindset and take a look at new trends and new avenues. And this was one of them. Let's treat the source. There's always supply and demand, supply and demand. So what we're trying to do now is look at the demand side.
It seems like lately the numbers have been a little lower. When we first started doing it, we would do approximately around 10 visits per week. There was more than that where we were actually, when we first started it, we were behind a little bit because there was a lot more than 10. We have 2 visits scheduled for tonight. We go to an overdose follow-up. I have no problem telling somebody that, you know, I know someone that has, you know, may have passed away or is battling the addiction of opiates. Police officers too, we're not just cops. We're human beings. We're fathers, we're mothers. You know, we have children too, and that we also know people that are struggling. So we're in this together. All right, so we're going to be coming up to an address real soon. So.
I'm really grateful. No, this is great. Thanks for choosing me. I appreciate it. Absolutely, yes.
Well, it was fine until they said police, and that tightened up my chest, gave me a little bit of fear. I in particularly fear them more here in Quincy because I haven't made it easy for them and they haven't made it easy for me. I'm an addict and I had a relapse. It's rather shocking when you open your eyes and somebody tells you what had happened. If there weren't people there, then 911 would not have been called, and I'm eternally grateful to whoever did that for me. I probably have used more times than not because I feel alone. So I'm really grateful that they're doing this, going to people like me. Because sometimes you just need somebody to say it's going to be okay, you know?
I thought it went well. So that was our second visit of the night. We made contact with the injured person. Both addresses took our resource packets, and they both took 2 doses of Narcan each. That's a quite common occurrence where we'll be in people's homes. They'll invite us into their homes, and they'll get comfortable with us, and it'll get really emotional. Just by that person speaking to us, I think that's good therapy for that person.
There's a lot of sad stories.
The good thing about this program is we just keep going back and seeing some of these people, and we know that, you know, part of the recovery process that people do relapse, and if you just can get them back on track, and you know, you never know, that could be the time that, you know, they could be sober for life or have a long time sobriety. So we just keep plugging away.